Well, as you can see, we're doing things a little bit differently than what we had envisioned on Friday. And the reason for that is that I had a potential exposure over the weekend. The person is getting tested, so we're waiting to hear back. But I wanted to, an abundance of caution here, we wanted to make sure that we're taking measures to make sure we're not spreading the virus. And actually, it really is a good reminder for all of us that we want to make sure that we're taking all the steps we can to slow down the spread of the virus. We have seen that our hospitalizations have dropped. Today, they're at 312, down from the high of 987. And our positivity rates have dropped and so forth. So we want to make sure that we continue to see that even though we're in the green category, that we want people to continue to make sure that they're wearing that mask when they go to the store, keeping that 6 foot of distance between you and other people when you're out in public, washing your hands often. And then one of the things I talk about is staying home when you're sick, specifically if you've got a cough or a fever. But one of the other indications that you may have coronavirus is if you've lost your sense of taste or smell. So that's another way that may be an early indicator that you may have the virus and would be a good reason to go get tested. We want everybody to, again, if you can avoid the 3 C's, those crowded places, confined spaces, close contact, that's how the virus spreads. And one of the other opportunities out there, of course, is to go get tested and Test Nebraska. 650,000 test results have been returned by Test Nebraska, and we're really focused on getting those test results back in a timely manner, 24 to 48 hours, and that is available out there for all Nebraskans. It's free, easy to use, so please, if you do, in the case I had, where you have that potential for a close exposure there or whatever, the person's going to go get tested, and so we'll hopefully hear back the not too distant future. And depending on the result of that test, I may be back in the office this week, or I may be quarantined like we did back in November, where I'll be following the rules to be able to make sure, again, we're slowing down the spread of the virus by quarantining. So again, it's important for everybody. I know it may be inconvenient for people to have to quarantine, but if you do have that close contact or a potential close contact, we want you to err on the side of making sure that we're slowing down the spread of the virus so that we can continue to make sure that we keep people healthy here in the state of Nebraska. Also along those lines, we have our new dashboard up, or, we over the weekend revised our dashboard. So that now we will be updating that about 9 o'clock or so in the morning, and be looking at specimen collection date as far as returning our test results back. Also on that dashboard is what we're doing with regard to our vaccines. And if you go look at the vaccine data that we had from last week, and looking from January 23rd through January 29th, you'll see that we were able to administer over 44, almost 45,000 vaccines, which means that we're really keeping up with the amount of vaccines that are coming in. So typically we're getting about 23,000, at least over the past few weeks, we've been getting about 23,500 vaccines in. And while we expect to start getting more this week, it shows that if we're roughly getting that many vaccines administered, we're keeping up pretty good. Also, same thing for the second dose. So now we're in a place where 3 or 4 weeks ago, we would have administered the first dose with either Pfizer or Moderna. And so we're getting those second dose vaccines out as well. So all good news there from the standpoint of getting people vaccinated and helping us work our way through this pandemic. Now, in general, now we've got a pandemic, or during the pandemic, there's no better time to be thinking about your health. Keeping a healthy mind, healthy body, healthy spirit is going to be important for enjoying the great quality of life here we have in Nebraska, really enjoying the good life. And certainly during a pandemic, we want to be paying a special attention to those, because staying healthy, reducing our stress, getting proper sleep, eating properly, all those things will help us keep healthy. And if we do get exposed, help us fight off that virus or any of the other viruses that we tend to get during the winter time. And so today we're really focusing on our wellness challenge again for this one, to be able to make that work for us. So we've got a number of speakers who are going to help us with that today. First of all, Dave Minerick, who is with the Executive Director of the Nebraska Sports Council, has always done our wellness challenge for us every year. And so he is here to be able to help talk about that and encourage people to sign up for that. We also have Dr. Adipur, who's the director of Douglas County Health Department, and she's going to talk about prevention and so forth. And then Sarah Shirley with the Wellbeing Partner will be able to talk us a little bit more about encouraging people to join our Well Power Challenge 2021. So really excited to have all those folks on here to be able to help us talk about that. And then just from my own personal standpoint, I just want to share with you that, again, one of the things I focused on starting last year and have recommitted to again this year is making exercise a part of my daily routine. So far in January, through January, I hit 30 out of 31 days on my, I'm a big Peloton fan, so I was on my Peloton and did over 715 miles. That was actually over 2,000 minutes. And it's one of the ways that really helps me to be able to clear my head, to be able to keep stress levels down. And really, it's something that if you don't do it, you start to miss it. And so again, part of that overall commitment to staying healthy, in addition to eating right, getting lots of fruits and vegetables, getting the proper amount of sleep, all of this can help us do that. And then if you look at employers here in the state, they've really been working on trying to create healthy work environments as well, because of course, if their people are healthy and productive, their companies, their businesses, their organizations are all going to do better. The Governor's Wellness Challenge, I recognized 14 employers here in the state who are creating those healthy work environments. And that's what we want everybody to be, again, thinking about how can I create that work environment that really encourages my people to be healthy, because ultimately that's going to be good for everybody. It's going to be good for the people. It's going to be good for the organization. You will be able to track all this, and Dave will give us more information on the website, which I believe is wellpowermovement.com. And so with that, Dave, I'm going to go ahead and bring you up to talk to us a little bit about this Well Power Challenge 2021.
Thank you, Governor. We appreciate your great leadership in the area of wellness. The Well Power Challenge starts today, February 1st, lasts through April 30th, and it's easy and free to participate. And the way you do that is you go to wellpowermovement.com and you register for the program. Over the course of the next 90 or so days, we encourage you to set a goal of achieving at least 100 miles. When you do that, you're going to earn your Well Power 100 virtual badge and a lot of other virtual badges along the way, but you're also going to qualify for some actual prizes that have been provided by our partners in this program. Wellpowermovement.com, again, is the website. There are social media components to it, but it's easy to log miles, and any kind of physical activity qualifies for mileage and can be converted to miles with the kind of the base unit being 1 mile walked or 1 mile run. So whether you're into strength training or martial arts or any other way of physical activity, and this year we actually have some mental wellness components that you can convert minutes of, say, meditation, family activity. You can convert those to miles as well, so you can rack up some mental wellness miles. We've learned that over the years, of course, that mental wellness is a chief component in your overall wellness, and so we're proud to take a bit more of a holistic approach this year. Last but not least, we have a lot of partners who are helping put this on. And again, it's free, it's web-based, and the reason it's free is because of these partners. Among those, stepping up this year are the Wellbeing Partners, which is especially a worksite wellness resource organization based in Omaha, and they are helping us take this to many, many companies. The wellpowermovement.com program has a great dashboard for company administrators, so they can use it as a great tool for company wellness too. And even though our challenge, the Well Power Challenge, is roughly 90 days this year, you can use the wellpowermovement.com website year-round. So it's available to anyone, everyone. Of course, we emphasize Nebraskans, but anyone, anywhere can use the program. And that's the basics of the program. Now, representing not only the Douglas County Health Department, but also the Wellbeing Partners as its chairperson this year is Adipur, and I'm going to have her, I guess, be the next speaker and talk a little bit about overall wellness and why physical and mental wellness activity is important.
Thank you, Dave, and thanks for having me here. And it is so nice that we actually have an opportunity to talk about what total wellness is: mind, spirit, and physical wellness. I think we all, for the last year, we have talked about pandemic and COVID-19 over and over. But you know, the underlying factor is we need to be healthy ourselves in every aspect of health. I just looked at the community health rankings last night. And when we look in regards to mental health, the newest health ranking from 2020, it said that on average, uh, the number of mental unhealthy day is 3.7 per month. That means every 10 day, on average, somebody has an unhealthy mental health day. Just think about that. Think about what can we do, and together with the well-being partners, we actually asked our community about this. What is keeping you up at night? And the highest number said it is our mental health issues. And we went then to the community and we asked them, what do you mean by mental health? And why is that keeping you up? They said, you know, because it still is not looked at as physical health. There is a stigma around mental health. And we really have issues. We don't know what the resources are in our community. So together with the well-being partners, we have been working on it, and I'm sure Sarah Shirley is going to tell you more about what some of those activities have been. But then when we look at physical activity, 32% of Nebraska residents are obese, not overweight, are obese. And that should also be a reminder of all of us what the governor was saying, you know, physical activity, healthy eating, those all matters. That even if we get COVID, we will be able to really fend that off in a much better way. And I want to encourage all of us to really do that, to have physical activity every day as part of our spiritual health, as part of our meditation that we have, but also really to have a healthy lifestyle. When we look overall in regards to physical inactivity, 23% of individuals in Nebraska are saying they have no special time set aside for physical activity. You know, we need to change that. And it can be done easily. You don't need to have fancy equipment. You don't need to have a gym membership. You can take some simple steps at home. You can take a walk around your neighborhood on a daily basis. There are ways to do it. You just need to start doing it. And that's, I think, where the well-being partners come in. They are giving us tools how to do it and how to do it successfully. I would just like to close in saying we need to be a healthy community so we can fight off whatever comes in our community. And we can do it. We can do it all together. The well-being partners are the community partners in this community who are going into businesses, providing toolkits for businesses how to do it in a proper fashion. I am so thankful to be a member of the well-being partners and being on their board. And really, I'm fortunate to now introduce Sarah Shirley, who has really done a tremendous job over the last year and so on to really bring us forward in this time when it wasn't always easy. Sarah, my pleasure to introduce you and tell us a little bit more what is going on with Wellbeing Partner and what with this challenge specifically.
Thank you, Dr. Poor, and thank you for your partnership with the governor in protecting our state. It's been incredible to watch you, and we're honored that you're on our board. So the Wellbeing Partners is a not-for-profit serving Nebraska and Iowa care providers, companies, and communities. What we believe is that when we build well-being into the way that communities grow and do business, we all thrive. Key factors, of course, of many health and well-being factors are physical activity and mental wellness. What we don't always talk about is those things are connected, just as the governor said earlier. And they're promoted when we move more and when we're outside. You've probably all been reading about vitamin D, and I'm not going to pretend to be an expert in all of that, but we know that as we move more, and even on a cloudy day, we're absorbing nutrients from the sun. And so this challenge is really exciting for me. I want to give Minneapolis a run for their money. We know that Minneapolis always ranks among the fittest cities, and they're not hibernating during winter. They're always outside. So I think Nebraska can kind of handle this and give them a little bit of a run for their money. So today we launched the 2021 Well Power Challenge. It is a part of the Well Power movement. We're honored to be a part of it. I want to just mention a few folks who have made it possible, and I want to talk a little bit also about the mental well-being work that we're doing throughout the state. So this was really made possible. Dave is incredible, and his team for the Nebraska Sports Council. It is fueled by our team with the Wellbeing Partners. I want to recognize Nick Cox, who serves as our workplace wellbeing specialist and has done a fantastic job to bring this to fruition. We're also grateful for Mutual of Omaha Foundation, City of Omaha Parks and Rec, City of Omaha, Size Shirts, and other sponsors who are joining us to make sure that not only can we bring you a great challenge, but you can also register for amazing prizes with an ability to win some pretty cool warm weather gear. So as you move more out there, please share your story. Share how you're feeling. Share how maybe a walk in around a lake or in a park is making you feel. Share the fact that you might be an ally for someone who is fighting a difficult mental health journey. So as part of the Well Power Challenge, please think of a campaign that we're using called What Makes Us, because it's a way that we can talk about mental health in a very normal way that we would talk about physical health or spiritual health. It's just another dimension of our well-being. So whatmakesus.com is a great place where folks are sharing their story across the state and really connecting folks around just having mental well-being and being a part of that. Now back to the Well Power Challenge. So this is brought to you by all of those partners that we mentioned, and it's very easy to use. So go to wellpowermovement.com. Dave's gonna help us just continue to update stories, badges, all kinds of fabulous things, and engage there. We hope to see you. And I'm gonna turn it back over to the governor.
Great. Thank you very much, Shirley and Audie. Dave, appreciate all of you being here. Now, Dave, I noticed that when you were talking about the different activities, you didn't talk about cycling. You talked about running. You talked about walking. You didn't say cycling. You got to remember to put cycling in there. But it could also be skating. It could be cross-country skiing this time of year. Lots of different opportunities for different activities to be able to get out there and make that commitment every day to do something around physical activity. Again, walking around your neighborhood, that is totally going to count. And I love what Dave also, including the mental health aspects, because you're absolutely right. Mental health and physical health are interconnected, and we shouldn't separate them out. We've got to have a healthy state of mind as well as a healthy physical body, and there shouldn't be a stigma attached to trying to keep our mental health, active. In fact, there was that weekly mortality and morbidity report that came out in August from the CDC that showed 40% of Americans were having some sort of mental health issue because of the pandemic this spring. So again, continuing to remain focused on how we can keep physical health, but mental health as well is going to be important. So again, we want everybody to join our Well Power Challenge 2021. Wellpowermovement.com is where you can find that. And with that, I wanted to just highlight that we're going to do questions and answers, and then the Lieutenant Governor Mike Foley will pinch walk for me today around the Capitol, since I can't be there with you, Dave, to do that. I know you always enjoy seeing me in my white tennis shoes and my suit walking around the Capitol. Unfortunately, this year we're gonna have to take a pass on that. But before we get into the walk, Taylor, I'm gonna turn it over to you, and can you see if we've got questions that have been sent in ahead of time, or if there's any questions from the media in the audience?
Yeah, I just have a pair of questions that were sent in by Chris Burbach. He asked, can you please ask a couple questions for me about vaccinations? When and how will vaccines be given to workers in meat packing plants? How is the state addressing workers' fear and skepticism about getting vaccinated?
So I'm sorry, so what was that first question there, Taylor?
How will vaccines be given to workers in meat processing?
So generally what we're talking about with all these different programs is the local health directors are organizing how they're distributing the vaccines in their area, because they're the experts, they're the people on the ground. So our local health directors will put together those plans when we get to the stage, whether it's going to be our meat processing plants, law enforcement, and so forth. There'll be a variety of ways for them to do that. We've done surveys with different employers to have an idea of how many people are going to be in that category, but it'll be our local health directors that really work together with those employers to be able to get those vaccines out. So it really will look differently depending on where you are. But certainly we can also follow up if you want to talk to some of the specific health directors about how they envision doing it. But you can imagine what we did with Test Nebraska or some of the testing regimes earlier in the spring of last year, where we would pick days and set up tents and do the testing and that sort of thing. So you might envision something like that happening at employers in different health departments. And then, Adi, I don't know if there's anything that you wanted to, since we've got one of our local health directors on here, Adi, is there anything that you want to add on to that?
The one thing I would add, I absolutely agree with the governor. It will depend on the community, but you could very well see that we are going into a meatpacking facility with a group of nurses to vaccinate in the facility. But also for smaller facilities, we could say you come to a special site. So it will be both ways that we are trying to do that.
Great, thanks, Adi. And then with regard to the second aspect of, how are we assuring people that, hey, the vaccine is safe and effective? That's one of the things that we talk about with regard to, the effectiveness, the 95% effectiveness. Certainly, if you look at the Do Right Now campaign, they have moved into talking about, and the reason I'm saying that is because I'm looking at an Audi screen, I can see your sign right behind her. But they're moving into talking about vaccines. We at the state are working on our own advertising campaigns that are messaging campaigns that are out there right now, talking about the vaccine and the safety and effectiveness. We've had doctors in here at our press conferences talking about it. So there's a variety of different ways that we've been communicating out to the public with regard to the safety and efficacy of the vaccines. And certainly want to encourage people to get that vaccine, because at the end of the day, this is how we work our way through the pandemic, is having people get vaccinated so they develop the antibodies so the virus can't spread.
A couple more questions that have come in. Martha Stoddard is asking, why did the state agree to only a 2-year contract with St. Francis? What is the plan after these 2 years are up?
So Martha Stoddard is asking about the St. Francis contract for Children and Family Services and taking care of the Eastern Service Region. We agreed to a 2-year contract because looking at the structure of this, because it's a new contract and issued under an emergency standpoint, we had to comply with the statutes to be able to make sure that, that's all really about all the farther we could do is do that 2-year statute or 2-year, because the statutes do a 2-year contract under the limitations of what we can do during an emergency contract.
Patrick with News Channel Nebraska says, with rural areas moving faster than Omaha and Lincoln when it comes to vaccinations, is there a planned adjustment to make sure parts of the state don't significantly outpace others as we move into later phases?
So I think when you're talking about some of the rural areas maybe being ahead, there's a variety of reasons for that. It could be the number of folks who are in phase 1A with regard to either healthcare organizations, those frontline hospital workers, for example, or our long-term care facilities. It could also be impacted by how many people were willing to take the vaccine the first time around. So there's a couple of things in there. What we're doing is we're distributing the vaccine based on a population basis. So for the population we're serving at the time, that's how each health district is getting it. As we get more vaccine, we'll certainly increase the amount of vaccine that's going to each health director's district. The other caveat I put in there is if we get more Moderna or Pfizer, that may change the math a little bit, because Pfizer requires the ultra cold storage. And so that's going to limit where we can put it, because we have to make sure we've got that ultra cold storage facility available. Obviously, we've got those in places like Douglas County, where we've got, Nebraska Medicine, for example, has those facilities. So but the general plan will be to distribute the vaccines on a population basis and not try to catch up one part of the state versus another. It'll just be along those lines.
Do we have questions from here in the room?
I'm sorry, say that again, Taylor?
I was just asking if there's questions in the room now.
Okay, great.
Yes, Governor, what's your comment about the St. Francis contract changes that seems to have practically or more than doubled the price for the first 2 years? And are you confident it's
could you hear Fred's question, Governor?
So, yeah, I heard Fred's question. Yeah, so Fred's asking about the St. Francis contract, again, for taking care of our Eastern Service Region. Obviously, we've increased the amount of the contract, and I would say that the amount of the contract increasing really is in line with what Promise Ship was charging beforehand. So even though the contract cost of this contract is up, it's not necessarily impacting what we were paying for for the Eastern Service Region before anyway. So it's still in the same ballpark there. And, you know, we're going to continue to work with St. Francis with regard to taking care of our children and our families in the Eastern Service Region. I've had the conversation with their interim CEO, Will Clark, and he's confident they've got a plan to stabilize their finances, and we'll continue to hold them accountable for delivering on the services they're supposed to deliver to our families here in the Eastern Service Region, as well as monitoring their financial stability and all the other aspects of the contract.
Other questions? Andrew?
Governor, how is that fair to Promise Ship or any other person who bids, and then all of a sudden they lose the bid and then somebody can renegotiate that bid later on?
So the question Andrew's asking is about, how's that fair to Promise Ship that, St. Francis bid the contract and then is coming back to renegotiate it. And certainly, it's already been well documented that the people who put forward the proposal on this are no longer with St. Francis, and they're being investigated for financial mismanagement, which is very unfortunate circumstances, but it's where we are today. And we've got to place the priority on taking care of our children and families in the Eastern Service Region. And so we've got to work with St. Francis to be able to continue those services, and that's what we're doing at the state, is we're prioritizing those families first. Obviously, there isn't a Promise Ship doesn't exist anymore to be able to, turn over a services to them. So we've got to work with the provider here, St. Francis.
Paul Hamill.
Governor, you're a businessman. You deal with companies that you trust. This is a company that kind of broke its trust. How can you continue to work with a company that, even if they let a couple people go, how can you continue to work with a company that really broke its trust?
So Paul's asking, can we continue to work with St. Francis? And again, we're prioritizing the children and family in the Eastern Service Region. So we need to continue to work with St. Francis to provide those services. We're going to work with them to be able to make sure they're living up to the efforts of those contract. And like I said, there is no Promise Ship anymore. So we've got to work with St. Francis to be able to deliver those services.
So you have no other choice, is that what you're saying?
Well, so again, we want to make sure that St. Francis is living up to their commitments in the contract with regard to taking care of our families. But they're the folks that we've got to work with to be able to deliver those services right now.
Are you considering having the state take it over in 2 years?
So the question is, are we considering having the state take it over in 2 years? Certainly, as we go forward in time, we're going to continue to review all of our options. But I want to remind people, there's a reason why we have a private provider in the Eastern Service Region. And that's because the state was doing such a terrible job back when they privatized this in the first place. So we got to remember what the history is and why we're here in the first place. And I think that having that balance with where we have private providers as well as the state is the best way to go forward to be able to make sure that we've got all of our children in the state taken care of.
Paul has another question.
Governor, what's your level of concern going forward about the spread of the virus? The DHMs have been relaxed, but yet we have these new strains that might be more contagious. What's your level of concern about relaxing DHMs when these new, more, powerful or more easily spread viruses are out there?
So we have set up a regime to be able to manage the virus here that is based on hospitalizations, because we've said all along, we're about making sure we're preserving our hospital capacity, right? That we want to make sure we provide that hospital bed, that ICU bed, that ventilator to anybody who needs it when they need it. We've done that successfully here in Nebraska by using that as our North Star, that hospitalizations. And that's what we're going to continue to do going forward. And so we're very transparent about how this all works. It's on our daily dashboard, we've got a website right there. So if we do see an increase in hospitalizations, We will see that we'll start putting more restrictions in place to be able to help slow that down. We continue to ask people to do all the right things around following, the rules, using the tools we've got out there, avoiding the 3 C's, keeping that 6 foot of distance, washing your hands, wearing a mask, staying home if you've got that cough or that fever, or you can't taste or smell, your coffee or whatever it is. Those are the things we want people to continue to do. And that system is, we've got the feedback loop in it, so that if we start seeing more hospitalizations, we'll see more restrictions come in place.
Andrew has another question.
Governor, can you, without, giving too many names or too much details, how did you get this close exposure?
So again, on Saturday, I was with somebody for more than that 15 minutes that may potentially have coronavirus. They're getting tested to be able to confirm that. But just based on their symptoms, we wanted to make sure that we're taking all the appropriate caution to make sure that if I was exposed, that I'm not spreading it to somebody else. And so that's why we're doing this from home today. And we're waiting to hear back from the response back from the testing.
Sorry, go ahead.
Small social gathering, or was it, for business, or how did that happen? Can you say that?
No, it was actually just more in the course of business. It was not a social gathering.
Ruda from KMTV wants to know, she says about 91,000 Caucasian Nebraskans have received their first shots, while about 2,500 African Americans and 3,000 Latino. And she wants to know if this, why we may be seeing these differences, and if this is a problem or a challenge.
So the question with regard to making sure that we've got an equal distribution of the vaccines is certainly one of the things that we're being mindful of. I think there's been a number of stories about, for example, some of the distrust in the African American community, and working to be able to overcome that through communications and so forth. I think also one of the things that you're seeing with regard to how the vaccines have been distributed is just also a function of where the vaccines have gone. We've been focused on folks who are in the long-term care facilities. I don't have the breakout by race or ethnicity about what those populations are, but that could be contributing to it, for example, or just the breakout with regard to frontline healthcare workers, where we've been in phase 1A. So we certainly want to make sure that everybody is understanding that this is something that's safe and effective. And if we do have objections or concerns, that we're really trying to work to overcome those.
Martha also is asking, will the state work on building up its own state capabilities so we're not forced to stay with St. Francis if things get worse?
So Martha's asking, are we going to build up our own capabilities? And again, we don't want to duplicate the work that St. Francis is doing, but we certainly are going to be making sure that we're monitoring St. Francis to be able to make sure that we're taking care of our families here, and we'll take appropriate actions as necessary.
Do you have any final questions from the room? Andrew.
What happens if St. Francis comes back in a few months and says they need more money?
Governor, did you hear that question?
Well, Andrew, you know how I feel about hypothetical questions. What we're going to do is just continue to work with St. Francis. Again, we've renegotiated a new contract here. We're going to continue to monitor and make sure they're living up to their end of the deal with regard to this contract, and making sure they're taking care of our children and our families in the Eastern Service Region.
Any final question? All right, well, thank you all for joining us. And in just a moment here, the Lieutenant Governor, Dr. Antone, and Dave will be doing a lap around the Capitol, so you're welcome to follow us out the door here in a moment.
All right, great, folks. Thank you very much. Appreciate it. Everybody have a great week. I want to say thanks again to Dave for leading the walk around. I know the Lieutenant Governor will do a good job. And thank you also to Dr. Poor and Sarah for joining us here today to talk about our Well Power Challenge for 2021. Everybody have a good one.
Thank you.